According to the American Society for Reproductive Medicine, up to 10% of women have this disease, and this disease is endometriosis. Endometriosis is a condition where tissues that is similar to the tissue found in the uterus grows abnormally somewhere else in the body. Not widely recognized like other female diseases, endometriosis can have an effect indirectly or directly in all of our lives. In this speech about endometriosis, I will talk about the history, the impact on the human body, and also possible cures. It all started roughly 100 years ago, when surgeon Thomas Cullen was the man who described morphological and clinical pictures of this disease. In 1920, Cullen discovered that there were sites where cysts, which are closed sacs, found in the pelvis during the surgery. At the time, he called the disease endonomioma. It wasn't until about 7 years later when another surgeon, John A. Sampson, gave it the name that we still use today. He came up with the name endometriosis through his fundamental papers on ovarian endometrioma. There are many different types of endometriosis. One type targets the lining of the abdomen. The other type causes problems in the rectovaginal region. And then you have ovarian endometriosis, but that is not all. On very rare occasions, even men can get this disease. In a case report from the Department of Internal Medicine and Pathology at the Horizon Medical Center in Dixon, Tennessee, only a few cases of endometriosis in men were ever reported. According to my mother, who was a sufferer since 2005, here are some common symptoms you can look forward to as a woman, which is very heavy bleeding during your menstrual cycle, extremely painful menstrual cramps, and also sometimes you have bleeding between your periods. More symptoms include pain with sexual activity, pain during bowel movements, infertility or loss of pregnancy, and pain during your back and your lower legs during your period. But these symptoms only scratch the surface. There's more hiding underneath. According to studies, there's a higher chance of getting a chronic disease if a woman has endometriosis. According to the Human Reproductive Update, written by Gynecology Unit at the San Raffaele Scientific Institute in Milano, Italy, they found the connection between women with endometriosis and with their body mass index and also with their skin pigment traits. When it comes to the body mass index, or BMI, they discovered that there were 11 studies that showed a relationship between endometriosis and the adult population. They also found 5 more studies with the same topic, but for young adults. For young adults with endometriosis, there is a relationship between endometriosis and a higher body mass index. And even with the factors included of age, birth weight, and if they use an oral contraceptive, like the pill, or a vaginal contraceptive, like the intrauterine contraceptive device, or an IUD. Also in the article, there was 4 papers that were published about endometriosis and the effect on the skin. For women with freckles or navi, which is a condition where there's an unusually high pigmented area on the skin, they'll be more sensitive to being exposed to the sun. But don't worry, there are treatments out there for this disease. After being diagnosed with a procedure called a laparoscopy, the same procedure that they use to diagnose this disease can also be used to help treat it. A laparoscopy, as mentioned before, is a surgical procedure where they use a laparoscope to have a full visual view of the abdomen. And with the help of the laparoscope, it can also help with the removal of the endometriosis growth. There are many different types of treatment options out there. But because endometriosis is a very complex disease, many women find relief by putting together multiple combinations of treatments. But for many patients, doctor recommends that they should change their diets. There was a study that proved that women who switched to a gluten-free diet saw a decrease in their pain. Nutritionist Erin Ludenek recommends that since endometriosis is an inflammatory disease, a good place to start is choosing inflammatory foods. Like wheat, dairy, soy, alcohol are common sensitivities. But unfortunately, if it gets worse, you have to go through a procedure called a hysterectomy, where they take the uterus out. This topic hits close to my heart, because as a teenager, I was showing the same symptoms as my mother did. So I was put on birth control at a very young age, because the doctor said it would help prevent me from getting it. But after learning about the impact on the body, the history, and the possible treatments, we can really take to heart this very rarely common talked about disease. Even though it might not be deadly like other female diseases, it's still worth acknowledging.